of this impressive and quite large 40-foot-long vehicle behind us. I am Dr. Robert Remstein, and I serve as the Chief Academic Officer here at Capitol Health. I'd like to start by welcoming and thanking Congresswoman Bonnie Watson-Coleman for her support and secured funding for Capitol Health and for being here as we celebrate the launch of this mobile simulation laboratory. I'd also like to thank our CEO and President, Al Magazine, for his exceptional vision and his steadfast support of projects like this. Today we're unveiling a new phase in academics at Capitol, and this embodies our determination to make learning active, engaging, and cutting edge. The addition of advanced high-tech simulation training for our physicians, residents, nurses, students, and staff in a state-of-the-art, unique mobile simulation laboratory epitomizes this. There are only a handful of these units nationwide, and as a mobile unit, we can bring training to our staff where they work and bring it to our clinicians where they work, as well as to the community that we serve 7 days of the week. We have made a commitment here at Capitol to become an academic medical center, bringing the best and brightest to Trenton and Central New Jersey, and practice through our residency programs in internal medicine, family medicine, emergency medicine, and transitional year training program. With our upcoming merger with St. Francis Medical Center, we are also going to welcome their 30-person internal medicine residency program, their schools of nursing, and their School of Radiologic Technology. This will help round out our academic footprint. Now, all of our clinicians must learn how to care for patients in a safe and controlled manner. Unlike when I trained in the last millennium, our current learners must utilize simulation scenarios and mannequins to hone their skills without placing a patient at risk. We all know that the doctor, the nurse, and the technologist who's caring for us practices their craft in a safe and efficient manner. When I went to school and did residency, we had an adage: see one, do one, teach one. That doesn't work anymore. That's not safe and it's not appropriate. The availability of units like this where we can train our staff and our clinicians in how to practice in a safe environment without putting patients at risk is critical to providing the safest medical care possible. I want to thank all the leaders who are here today and those from Capitol Health who helped us develop and deliver this experience to our employee community and our broader community. I want to take the opportunity now to introduce Al Magazine, our Chief Executive Officer.
Thank you, Dr. Remstein. I want to take a second and thank the Congresswoman for actually taking time to be here. Give you a little history. She's been our supporter. She's supported our district many years. And the fact that she is here physically today, so we can do the ribbon cutting and start this program, it's really extraordinary. So thank you for that. As Dr. Remstein pointed out, this is just more than a sim lab. This is symbolically the most important part of a big program that we've initiated. Some of you may know about this, some of you may not know, but you'll get to know a lot more about it as we move forward. Two issues. One is that, as Dr. Remstein pointed out, we've decided to become a lot more academic. We have tripled our size of our residency programs. We are definitely looking at some fellowship programs. This will become, within the next 2-3 years, this will become a major academic center, not only in terms of residents and fellows that will be training, but based on what Dr. Remstein told me, very soon we're going to see over 100 residents running around Capitol Health. Maybe you're already seeing 100 residents running around Capitol Health, and 30 more coming from St. Francis. I'm so happy that I can stand here and tell you that Capitol Health is in the position to actually save the program that St. Francis worked so hard over so many years to actually establish and run. And this partnership with St. Francis is extraordinary for City of Trenton and surrounding communities. that cardiac surgery program is going to put RMC Regional Medical Center in Trenton at a different level. I always said this is going to be a Cooper, it's going to be a Cooper. Why? Because you already have trauma program here, you already have neurosciences programming, now you're going to have cardiac surgery. Those programs combined will create the basis or the foundation for what our vision's always been, to create first-class academic health centers, health system here in Trenton, and that's going to happen. I don't want to get into side issues, I want to focus on this. So this is going to be used to train the residents, this is going to be used to train the future doctors at every possible level, every single specialty, and it's essential that we have this. And Dr. Ramsey pointed out, there are very few of these in the country. And the fact that we got one, and she secured the federal funding, you know how tough that is. It's a competitive process. Somebody loses, somebody wins. And we won. Trenton won, Capitol Health won, people of Trenton won. And this is huge. It really is. You know, first of all, it's pretty expensive. Secondly, the use of it is so significant that we can actually take this anywhere we want to take it to train the people. The second piece of my talk today, and I don't want to take too much of your time, I'm very excited about the second piece, is the Trenton Neighborhood Initiative that we announced about 9 months ago. That Trenton Neighborhood Initiative is going to have a real serious social impact of what goes on in Trenton. This is for the first time a private business has made a commitment to raise $10 million for a social program. Out of that 10, they already raised over 6. I'm very, very happy to tell you in the last 9 months that we have raised $6 million out of that 10. And once we hit 10, you know I'm going higher than that. That's just step one. And the last one that came in actually came in this morning. Bank of America pledged $700,000 this morning toward that program. It's taken off like there's no end to it. Bristol Bonds is $2.5 million. The first one that they did is amazing. And everybody else who's participated in this. And, you know, that program is based on 4 pillars. And I'm going to put things under each one so you understand what I'm talking about. So we're talking about live. Live meaning that we are going to get into housing for people of Trenton. New housing, rehab housing. I'm going to have Eric Schwartz, who runs that program, Dr. Schwartz, tell you about what happened last night. We started this last night. The second piece of his work, that is where Dr. Ramsey comes in. What that is basically, we're taking our existing employees of Capitol Health that work in the kitchen, that work as housekeepers, that work in places where they don't believe that there's any hope for them to go any higher. We're taking those, we're taking through a partnership, we're taking students from Trenton High, we're going out in the community finding people, we're going to bring these people in, we're going to train them in nursing, in the School of Radiology, School of Neurology. I mean, he's got so many programs. They're all going to be professionals. And it's a certificated program. Then those programs are connected. We already done this with Rider University and Trenton State College. Rider University has given us a program. We've invested $500,000 in Rider's program. For that, they gave us opportunity to give every employee or their dependents a 50% tuition discount. 50%. And we, Capitol Health, will do our tuition reimbursement program, which is another maybe 25%. So what happens is, these people that absolutely have no hope, they get trained, they become techs. From techs, they can get their bachelor's degree, they can become nurses, they can become nurse practitioners, they can become CEOs, they can do whatever they want. The sky is the limit. We're committed to this. This is already happening. So that's the second piece of this Trenton Neighborhood Initiative. The third piece is grow. Grow is what I just talked about. You start from a low-level job, you go to CEO. That's where the growth is. And Capitol Health has set aside hundreds of positions for these people to take advantage. I'm personally taking responsibility for it. You have no idea how excited I am. Waited forever to do this. Now we're in the position to do it. And then connect. That is digital connection. That's internet that does not exist in Trenton. Most people don't have it. I'm going to have Dr. Schwartz, I'm going to end this in a minute, but I'm going to ask Dr. Schwartz to come forward. He wasn't on the schedule, but he's going to say a couple of things.
Thank you, Al. So, I just love the vision, and the timing of this is just so perfect because last night we had our first open house for the Live section of the Trenton Neighborhood Initiative. So we have a home buyer assistance program. Yesterday was our first open house in the city of Trenton where families could come and say, I want to buy a house in Trenton. How do I do it? How do I get the financial resources to do that? How do I get down payment assistance? Our first night we had 40 families that came out to learn how they could buy a home in Trenton. Tonight is our Spanish language open house. We hope to have that same enthusiasm. This is an evidence-based program, best practice. Really looking for all over the country. How do we bring these resources to Trenton? So I look forward to being back here next month and the month after, talking about people that are actually getting into homes. So just thank you for that moment, just to highlight that.
So, how does it connect to Simulation Lab? It connects to Simulation Lab because we're going to take this lab and we're going to train these people in these technologies that I just talked about. This is all coming together, and the fact that Congressman is here today honestly just seals the deal. This is going to become a national program. I am telling you, it's going to become a national program, and people are going to come here to look at this, see how we did it, and they're going to copy after this. I know it for a fact. Give it 3 years, we're going to be there. This ends what I was going to say, and I want to thank you again. Please come forward. Would you like to say a couple of things?
Good morning. See, I don't know what you just heard. What I heard was, Bonnie, Kelly's going to be reaching out to you because as we move through the various opportunities to identify important programs that will service the needs of our communities, I'm going to have this. So this was my warning, and I appreciate it, and I'm sure that between Kelly and the CEO, we will be full, and Dr. Memsey, we will be fully informed when it comes time to advocating. And advocating we will, because I'm going to tell you, it is a pleasure to be here today, Al. It is, it is a fruition of a conversation you and I had so many years ago. I don't know who he is talking to then. But I always said to him, you've got these ideas about building this other big hospital and then having this trauma center, and I was concerned about taking certain services with Mercer Hospital out of the city of Trenton, and he promised me that under his vision, Trenton would not be left out. And so I thank you for being true to your promise. I see so much promise in this. Not only do we get to be on the map as a national model for excellence, but the people who live in a city who are traditionally underserved, where you see disparities in health and access to health and healthy living environments, job opportunities, and housing, you're bringing all that together, and you are recognizing that Capitol Health is a part of this community, and there is a holistic approach that you are discussing that is going to elevate the living conditions, the opportunities, the expectations, and the prospects for good jobs, good homes, good healthy living for the people that are here. And so it's my delight to be here as we snip the, I think that's going to be virtually, right? We're going to, okay. I'm glad to be here to cut the ribbon on something that we helped to bring to fruition. We did not do this alone. This is the hard work and the vision of your CEO and your other staff. So God bless you. Continue to do this good work, and we will be on the map, and we will be the go-to in this region where people will travel from far and near to be treated here at the Capitol Health Complex. Thank you, and God bless.